Once again, good evening, everyone, and a very warm welcome to our webinar on tummy tuck surgery. My name is Lexie, and I'm the Senior Staff Nurse in Plastic and Cosmetic Surgery here at Benenden. I'm delighted to be joined by our expert speaker, Mr. Adam Blackburn, Consultant Plastic, Reconstructive and Aesthetic Surgeon. Tonight's session will begin with a presentation from Mr. Blackburn, followed by a live Q&A. And if you have questions at any point, please feel free to submit them using the Q&A icon at the bottom of your screen. You're welcome to ask anonymously or include your name. And just a quick note that the session is being recorded, so any names shared may be visible in the recording. To help us get through as many as possible, please keep these questions brief. If you're interested in booking a consultation, we'll share all the relevant contact details at the end of the session. So as I said, my name's Lexie. I've been a nurse for about 10 years. I spent 5 years in intensive care in Bristol and London. I joined Benenden in 2025. I've worked in London as a director at a hearing clinic, and I have a master's in international marketing and consumer psychology.
Thank you, Lexie, and good evening, everyone. Thank you for joining us. My name's Adam Blackburn, and I'm a consultant plastic reconstructive and aesthetic surgeon. And I'll be talking you through tummy tuck surgery and liposuction this evening. My background is that I'm on the GMC Specialist Register for Plastic Surgery. I trained at Imperial College School of Medicine in London, and then went on to do higher surgical training in the northeast of England before coming back down south to do fellowships at St Thomas's Hospital and the Queen Victoria Hospital in East Grinstead, along with trauma fellowships in India. Now, I've been a consultant for about 14 years, and my practice is focused primarily on breast and body contouring. So in my repertoire, I do breast augmentation, reduction, mastopexy, and abdominoplasty. And I have a particular interest in functional abdominoplasty, which is more than just being about appearance. It's about improving posture, restoring core strength, and sometimes even pelvic floor symptoms. I also do a lot of microsurgical breast reconstruction, where I transplant tummies to make breasts. So the sort of aesthetic side of my practice feeds into my reconstructive and vice versa. Yeah, next slide, please. So this is to sort of just summarize what we're going to go through this evening. We'll start off describing what happens when you come in for a consultation, and then I'll go through the nature of the surgery itself, whether that's tummy tuck or liposuction or a combination of both. We'll quickly go through what's involved with your hospital stay and recovery and show you a typical good average result, and then have a question and answer session. So the consultation starts with a full 45-minute consultation, and this should be an unhurried appointment where we discuss your goals, and I then assess your anatomy and work out what I can realistically achieve and what's likely to work best for you. We'll go through lots of pictures of before and afters, hopefully with patients who have previously consented to their photos being used, so I can show you what's a typical sort of result for somebody with your body shape, and we'll try and make a personalized plan that's particularly tailored to you, because even though everyone's got a tummy, not every tummy is the same. Sometimes what becomes apparent is that you may benefit from a combined procedure, whether that's a little bit of liposuction to refine the tummy tuck, or whether a mummy makeover type procedure where breast surgery is performed at the same time as the tummy tuck to improve your silhouette overall. So tummy tuck surgery is also known as an abdominoplasty, and it's everyone knows it's about improving the appearance of the abdomen, um, but it's also about improving core strength. Most people who come for a tummy tuck will have had children before. Some will have just lost a significant amount of weight and have loose skin. But if you've had um, children and pregnancies, the six-pack muscles are often separated, which is known as rectus diastasis. And that stretching weakens core strength and can affect pelvic floor strength. So part of the procedure is to put the muscles back together to give you a strong tummy so you can get back to planking or sit-ups if you want, and also improve the how things look by getting rid of some of the stretched loose skin that overlies it. So tummy tucks work for people who have lots of loose skin, um, and would like it to achieve a flatter tummy. It significantly helps with confidence, um, and helps with clothing choice. Many women who haven't worn a bikini for many years will feel confident enough to wear a bikini afterwards. And often feeling strong in your core makes you feel younger. You know, you can trampoline with your kids again if that's what you wanted to do. And you can get onto proper fitness regimens with the PT, which you wouldn't otherwise have been able to do. Tummy tuck surgery isn't a weight loss tool, I'm afraid. You need to be at your happy weight before it. And by happy weight, I mean the weight that you'd want to be for the next 10 years. If we do the surgery and then you um, lose weight, you'll end up with loose skin that could hang over the scar again. If you put on weight, that may stretch the repair of the rectus diastasis apart. And getting pregnant is a bit like putting on lots of weight. So it's best to have had your family complete before having this type of surgery. So most of what we do is a standard abdominoplasty, which involves a cut around the tummy button, and a hip to hip scar. If you want to know how long that hip to hip scar needs to be, if you sit down and let your tummy hang out over the top of your underwear, there'll be a crease. And where that crease ends on the side is how long the scar needs to be to avoid dog ears, which is an unflattering sort of bunching of skin at the end of the scar, which can occur if you try to make the scar too short. During the surgery, the skin between the tummy button and the top of the pubic hair is excised and thrown away. And then the skin above the tummy button is lifted all the way up to the edge of the rib cage and then stretched down to be sewn up over just above the pubic area. Before doing that, if the six-pack muscles have separated, that separation is repaired with permanent sutures. So you have a nice strong repair that can't can't stretch too easily again. So to emphasize, with a standard tummy tuck, there is a scar that goes around the tummy button and a hip to hip pom. And that's slightly different from a mini tummy tuck, which I think we'll talk about a bit later. So with a mini tummy tuck, this is for ladies who predominantly have loose skin below their tummy button and their pubic area. And it works best for just getting rid of that sort of the fold, often over a cesarean scar. During the procedure, it is possible to elevate the tummy button without a scar. So the stalk of it's detached from the sinews between the six-pack muscles. One can still repair the gap between the six-pack muscles, but the skin isn't pulled quite so tight. And that avoids the scar around the tummy button, though it does lower the position of the tummy button by a couple of centimeters. It's not very good if you've got a lot of skin laxity between the breastbone and the tummy button area. So if I were to do 100 tummy tucks, probably only 10 of them would be a mini tummy tuck. The rest would either be a standard or an extended tummy tuck, which are much more common. This is an even more aggressive tummy tuck than a standard one, in that the skin is excised in a horizontal and a vertical direction. So if you've lost lots and lots of weight, you will have not only a vertical excess of skin, but a horizontal excess of skin. And this is a really powerful technique for narrowing somebody's waist and improving their silhouette. However, it does put a scar that goes from the bottom of the breastbone all the way down to the pubic region, as well as the hip to hip scar. And this is an extended tummy tuck for people who have less of that vertical laxity, but do, when they sit down, that roll that goes over their underwear goes all the way around towards their buttocks. And this, so as you can see, the scar goes probably 2/3 the way around the circumference of the body. And it can be a very powerful technique to improve some of the fullness in the sort of outer hip area. A 360 tummy tuck is talked about quite a lot on social media, and that's where somebody has, the other name for it's a belt lipectomy, because you excise all the way around the body. I'm not a fan myself of doing this in one go, in that if you've had a tummy tuck and the skin on the front of you is pulled nice and tight, I normally want you walking slightly stooped for about 10 days. But if you're walking stooped, you're then pulling on the skin on your lower back. So this operation can have quite a high complication rate, in that the wounds can either fall apart at the back or the front, or the surgeon then doesn't pull the skin tight enough, and the skin becomes loose and needs a small revision. I often think if you need one of these, it's likely that you probably would benefit from multiple surgeries, whether that's breast reductions or uplifts, or arm lifts, otherwise known as brachioplasties. So it'd be best to do an extended tummy tuck in the first instance with another procedure, such as a thigh lift or an arm lift or breast reduction. And then at a second operation, you can then do the excise the skin from the back, and you're much more likely to get a result without a complication. So, as I've mentioned earlier, rectus diastasis or diastasis recti, and that just means the separation between the six-pack muscles. And in the left picture, you can see there's just a separation around the tummy button region, and on the right, there's a separation that goes all the way from the breastbone to the pubic area. And I know from doing research with army doctors that if that gap between the two six-pack muscles is over about 4 to 4.5 centimeters for an average sized woman, she will get symptoms of lower back pain and pelvic floor weakness that are improved with repairing that gap. And having worked with patients in the armed forces, we know that ladies who are pre-pregnancy, high-performing athletes, whether they were on the Great Britain bobsleigh team or Commonwealth sprinters, even had a lacrosse player for GB. Once they had kids, they weren't able to get back to their usual exercise regimens, and their fitness fell off a cliff and they became quite depressed. But having put their six-pack muscles back together, they were able to get back to training, and their quality of life was significantly improved. So as well as improving how they looked and getting them back to wearing bikinis, if that's what they wanted to be doing, they felt strong, and able to keep up with their male colleagues at work for physical activities. Here's a sort of a good average result of a lady who's had combined surgery, and that she's had a breast reduction and an extended abdominoplasty. And you can see that the scar around the belly button is slightly inside the belly button dip, so it's difficult to see. And the hip to hip scar would be hidden by a slightly fuller bikini bottom. So liposuction, like an abdominoplasty, is also not a weight loss procedure. What it's brilliant at is eliminating stubborn areas of fatty disproportion. And it relies on making little small holes and then putting a cannula, which is a tube with holes at the end, and attaching that to suction so I can suck out fat from underneath the skin. And if you've got good skin quality, the skin will then retract and you can get a very good improvement in your contour without the needs of long scars. So it does rely on having good skin quality. It's not a weight loss technique, but just good for refining stubborn areas of fat that won't go with diet and exercise. And yeah, so this is just to remind me to remind you that the Benenden is a brilliant little hospital that hasn't had any significant infections, whether that's bacteremia, that's bacteria in the blood, or nasty MRSA, septicemias, or Clostridium difficile. We're very proud of this record. The operating theatres are nice and big and clean with all the latest operating tables, liposuction equipment, and it's a real pleasure to be able to work there. After a tummy tuck, you may have a drain for the first night, depending on how much tissue is removed. And sorry, we've got a this. Apologies. Team Blackburn just locked the dog in the room with me. But yeah, so tummy tuck surgery is really good surgery for improving quality of life. The way we do it's very safe. Patients are in hospital for one night in my practice. Many will have a drain because I think it's a really good way to know that there hasn't been any bleeding under the skin, which can sometimes get missed. The drain comes out the next day, and patients go home in a post-operative girdle and wearing TED stockings for 10 days. The girdle they'll be wearing day and night for 6 weeks, and that compresses um, the, the tummy skin back onto the six-pack muscles to stop any fluid collecting there. I like patients to walk in a sort of a T-Rex position, so they're slightly stooped for the first 10 days. Lexie and I will see you to about a week to 10 days post-operatively, and everything's healing beautifully. We can then get you walking straight. And at that time, you can then go from sleeping on your back to sleeping on your side. It's not uncommon to feel quite bloated initially after surgery. And what I like patients to do is to buy their girdle or get the girdle off Lexie preoperatively and wear it for 3 or 4 nights and 3 or 4 days consecutively. So they get used to the tight feeling of wearing it preoperatively. So there aren't any surprises from the discomfort just from wearing a girdle after surgery. Putting six-pack muscles together can be quite tender. And when I was training, patients would be in hospital for 3 or 4 days. But we now know that by using lots of dilute local anesthetic, I can make sure that you wake up completely comfortable with just a mild feeling of tightness rather than a feeling of a nasty pulled muscle. Patients, when they are still, should be very comfy. When they get up and move, they will feel like they have got a mild pulled muscle. So patients will go home with paracetamol and ibuprofen and may need an occasional codeine, but that's not the norm. Patients potter about in TED stockings and their girdles for a couple of weeks. They're driving after about three to 4 weeks, and then they're back doing gentle exercise like starting couch to 5K or a beginner's Pilates class at 6 weeks. I tend to use dressings that will survive a gentle shower, so patients can shower from day one. But it is 6 weeks before patients are back sort of picking up children and doing heavier activities. With this type of surgery, we'll need you not to have had a long haul flight for 6 weeks before surgery. And I would really want you to be in the country for another 4 weeks afterwards to make sure there are no issues if you were planning any holidays afterwards.
Thank you, Adam. So now we can move on to our question and answer session. We're really pleased to have so many of you with us today. We may not answer all of your questions, and we'll do our best to cover as many as we can. And on the slide after, you can find information on arranging treatment. So, Adam, we have a question asking that if I have excess skin around my lower back, would a standard tummy tuck be able to target some of that skin, or what would be able to tackle that area if not?
So that's probably not is the answer. A standard abdominoplasty just deals with loose skin on the front of the tummy. When that is turned into a belt lipectomy or a 360, that tends to sort of more lift the buttocks than treat lower back. Depending, normally I'd probably be thinking is a thing called a bra line backlift, where there's a horizontal cut at the level of the bra and the skin's excised, which then pulls things nice and tight over your back, and the scar is then hidden in the bra strap. So that's a slightly different area of body contouring surgery, but it can be done as a combined procedure or as a separate procedure, depending what the area of concern really is.
Thank you. And another question, does this surgery impact or support pelvic floor prolapse repair surgery?
So this is a really interesting question, and you would think that if you reduced the distance between the six-pack muscles, that would increase the pressure in the abdomen and make pelvic floor prolapse potentially worse. However, the urogynecology colleagues that I talked to about this say that many ladies will find it difficult to properly engage their pelvic floor if they've got a weak core. So I think it's easier to do pelvic floor exercises after you've had this surgery. So in theory, it could make it worse, but in reality, that's not what we often see. Ladies tell me that they have a stronger floor afterwards.
Thank you. Another question is around whether we give Fragmin after a tummy tuck.
Yes. Yeah. While you're in hospital, you'll have a Fragmin injection. That's right. But unless you've got had multiple miscarriages or known to have a sort of a clotting disorder, we wouldn't normally send you home on fragment after this type of surgery.
Okay, thank you very much. Thank you again for your questions and for being part of this evening's session. If we haven't covered your question and you've provided your name, we'll follow up with you via email. And as a thank you for attending, we're pleased to offer 50% off the value of your consultation, a callback from your dedicated private patient advisor, an email with a recording of this session, treatment information and loyalty reward points, and updates on future events and health news. We'd really appreciate it if you could take a moment to complete the short survey at the end of this session. It helps us to improve and tailor future webinars to your needs. If you'd like to speak to someone to book a consultation, our private patient team is available until 8 p.m. this evening and from 8 till 6, Monday to Friday. You'll find the contact number on your screen. We also have upcoming webinars on a range of topics, including diabetes management, urology, and orthopedics. You can sign up for these on our website. Finally, a thank you from all of us here at Benenden Hospital for joining us. We hope to hear from you soon. Take care and goodbye.